Hello, I'm Dr. David Johnson, Professor of Medicine and Chief of Gastroenterology at Eastern Virginia Medical School in Norfolk, Virginia. Today I wanted to spend a minute or two and talk to you and highlight an association of minimal hepatic encephalopathy and impairment of driving. Now let's back up. Minimal hepatic encephalopathy, what is that? Well, it's a disease that's associated with cirrhosis, but on a subclinical level, an impairment of neurocognitive function. Now, I assume that most of you are aware of overt hepatic encephalopathy, a very prevalent condition in our population with cirrhosis, but something that is very, very easy to make the diagnosis. Minimal hepatic encephalopathy requires a battery of neurocognitive and neuropsychiatric tests that are not practical for most people to administer in the office. Now, why is this important? Well, first of all, it's a prevalent condition. Up to 80% of cirrhotics have minimal hepatic encephalopathy. Secondly, it's an association that can very frequently progress to overt hepatic encephalopathy. Third, it does impair quality of life. And fourth, pertinent to today's discussion, is the new observation that it may be associated with significant deterioration in driving. Now let's back up. Why would that be? Well, if there was deterioration in neurocognitive function, and you then say, what skills does it take to be a good driver? We have to know where you're going, so loss of awareness, loss of vigilance, loss of attention, loss of response time, and loss of navigational skills might have significant potential to be associated with impaired driving. And very much this case has been evident now with minimal hepatic encephalopathy. Those deteriorations, I think, are very predictable for a lot of drivers on the roads today, but not all of them have minimal hepatic encephalopathy. But why would this association even come to be? Well, it starts with an observational study that was published in the fall of last year in the American Journal of Gastroenterology by the authors at the University of Wisconsin. And what they associated with the diagnosis of cirrhosis was a 4 to 5 times increased association of likelihood for traffic accidents, moving violations, and even fatalities that were unassociated to alcohol. So taking this a step further, now they looked at a prospective study, and they brought in 47 patients with cirrhosis, 36 of whom met the criteria for minimal hepatic encephalopathy, 11 did not, and then had 40 controls. They did 3 things. First, they did a driving assessment by a driving simulator study and found that there was a significant deterioration in driving function with comparison to the patients with minimal hepatic encephalopathy and those without, or the controls. So much so that the significance of deterioration in function was a p-value of 0.0001. Then they took it to the patients themselves and did a driving assessment tool, and this driving assessment tool survey allowed the drivers to assess their own ability to drive. It might not surprise you that all the patients, even with or without minimal hepatic encephalopathy, thought they were relatively good drivers. But then they took it to a family member or somebody that drove with these patients regularly, and in fact the observation of the driver was just the opposite. Very much tied to the diagnosis of minimal hepatic encephalopathy was an association with absence of function or deterioration of function and response times. And these patients were clearly identified by the other participants that were in the car with them, the same as the ones that were driving had identified themselves as a good driver. So what does this all mean? Well, it means that physicians need to start talking to the families as well as the patient with cirrhosis and start to look at ways that we can identify these minimal encephalopathy patients. Now, on the short-term horizon, there will be some computerized tests that will make it a lot more facile to deliver the diagnosis or establish the diagnosis of minimal hepatic encephalopathy, and perhaps even more importantly then to counsel these people about driving, potentially telling them not to drive. That's a huge implication for patients if you do that. Next, it will also be important to see in prospective trials if treatment of minimal hepatic encephalopathy will change their driving skills. This will be something that will be a subject of forthcoming trials. But until then, I think it's important to A, recognize it, B, discuss it with the patients and their families, potentially take them out of harm's way, and perhaps look in the rearview mirror next time. Wonder if that patient behind you has got minimal hepatic encephalopathy. I'm Dr. David Johnson. I hope you've spurred some interest in this topic. I'd invite you now to connect with peers and colleagues and connect with them now by clicking this below on the button. And I look forward to talking about another topic of high interest in the near future. Thank you very much for listening.